Okay, first type of e-stim we're going to talk about is using a direct current. So direct current, again, reminder, is that unidirectional flow. Okay, and we use it most often when we want to really directly target certain specific areas. So we potentially use it, these are almost always low voltage stimulus, so 0 to 150 volts. And we're usually trying to get a long current flow in order to target the tissues or target the physiological response that we want. So most common uses to stimulate denervated nerves and denervated muscles. So if someone has like Bell's palsy or polio, they would use point stim kind of directly over the belly of the muscle. And because you use the direct current, it's easier to potentially target directly, but you really want to watch out on fatiguing the muscle. And it doesn't increase the regeneration of the nerve, it just keeps that muscle and muscle fibers able to fire while the nerve recovers and regenerates on its own. Peripheral neuropathy, kind of same idea, same concept, but if someone has nerve damage and that nerve is healing, we want to keep the muscle strong and functioning, so we might use direct current for that as well. And in those cases, we're not usually worried about fatigue as much because of what we would set up. There's also medical galvanism, which is where we actually, based on if we put a negative electrode, so a cathode, or a positive electrode, or the anoid, over the tissue that we want to target, we can get a different response because we can change the pH level of that tissue. So the pH under the cathode, the negative, usually becomes more basic, so the pH increases. And when that happens, we usually get a situation where the sodium ions end up interacting and interacting with water, and that it's more likely to soften areas. So proteins kind of liquefy, we decrease nerve irritability. So if we had scar tissue or something that was maybe like myositis ossificans or something that is a hardening, we'd want to soften it, we'd be much more likely to want to put the negative charge over that. If we have a positive charge, putting the anode over it, we'd be more likely to get hardening. So that we would do if someone was in the inflammatory process and we wanted those tissues to strengthen up, right? So maybe in the proliferation, remodeling, one of those phases, we'd want that tissue to kind of strengthen up. So we would potentially do that. But if something is already hard, okay, some sort of osteogrowth or calcification, we'd potentially want to decrease that as well. So you can also see from this chart some different ideas that happen. So more likely to get clotting. So again, maybe early in the inflammatory process. We get extermination of microorganisms. We also get antibacterial effects with the cathode, proliferation of epithelial cells, increased collagen sensation. So again, when we're trying to promote growth in the area. The main reason we're going to use a direct current is for iontophoresis. And what we're trying to do here is drive ions with electricity. So the goal is to open up kind of those pores and those channels in the skin and use the whole idea of like charges repelling like charges to push the medication, which has been ionized in its preparation, into the tissue of interest. You need a special stimulator to do this, so we have our separate ones that you'll get to see and use. So the effects that we have are pain relief. It really is based on the medication that you use. So we have this little chart up here. So if you want some pain relief, you could do something like lidocaine, which is a positive polarity. If you want inflammation, you could have a negative polarity, which would be dexamethasone, or there's hydrocortisone, which would be positive. So it depends on the drug you're using. If you have calcium deposits or something that, again, is maybe a hardened area, you can actually use acetic acid, which if you think back to maybe your random knowledge, acetic acid is another word for vinegar. So just good old distilled vinegar. So when we practice in class and I'll show you with vinegar. But these are just certain list of medications. There's certainly more. And you would have to know their polarity to be able to use it. But so you can get pain relief, we can anesthetize, we can numb the area, we can decrease inflammation, we can decrease calcium deposits. Advantages of using the iontophoresis is that you get to put that medication in the place you want it. So it can be very specific. Instead of doing an injection, which might be painful, people don't like needles, you increase the risk of infection. You could use this as a way to do that. It avoids also when you're taking meds, right? When it has to go through your liver, it's what we call the first pass metabolism. For those of you that have taken drug and sport already, that first pass metabolism takes away some of the effectiveness of the drug. So usually your dosages have to be higher. So if you're going directly to the area of interest through iontophoresis, you don't have to worry about the liver. Also, it doesn't have to be digested, so you don't have to worry about any GI side effects as well, gastrointestinal side effects. It's also usually portable, so that's another benefit. Disadvantages, you're potentially, again, using the medication to just kind of mask the problem, especially if you're just anesthetizing, if you're just blocking the pain. What's really going on and how are we healing the area? You have a risk of potentially electrode burns, just like you would have with any e-stim, and the current density can be a little intense in Ionto, so it might be even a little higher bit of a risk. And there's some debate on whether it's even possible, if these medications can really get deep enough to target tissue. Usually we're talking somewhere between about 4 and 20 millimeters. That's where the medication directly gets driven. But the electricity is also supposed to open additional channels that allows that medication to diffuse into the deeper tissue. So even if your tissue is not exactly 4 to 20 millimeters below the surface, in theory, it's supposed to open up additional channels. They've had a hard time measuring that and being able to prove that, but that's the theory. So as far as indications, reasons we would use it, it's all the effects that we talked about. Basically, it's all the effects of the drug that you would choose to use. That's the indication. So when you're picking your indication, again, you'd have to pick and know the polarity of your medication so that you could set it up properly. Contraindications, all of those general contraindications we talked about with e-stim in general, as well as you have all the contraindications of the medication. So again, medications, these are prescription medications, they would have to come from a physician. And so all of those side effects and all of that would need to be shared, and you would need to know that. So again, no implanted pacemakers. You wouldn't want to put this over damaged skin because it could irritate unless you're directly trying to affect wound healing. If they have any drug allergies to this drug, that would be a contraindication. You wouldn't want to go up their transcranial area, the orbital area, not over the lumbar or abdomen in the pelvic area. Again, precautions, do they have impaired sensation? Is there recent scar tissue in that area? Because that might block the ability for the medication to enter. And again, is there any exposed metal? So then our steps. So pre-application steps. So every time we talk about using a modality, we'll go through these different steps. So pre-application steps, you want to make sure that you've evaluated the injury, made the proper diagnosis, that you've set your goals, okay, between you and your patient, and then that you match the effects of the modality to those goals. So think to your evidence-based kind of decision-making tree and the decision-making kind of schema that was laid out in Chapter 3. Eventually, you have to determine, does this modality meet my patient's goals? And so we want to do that, obviously, before we would go with the treatment. You want to then get either a pain scale or maybe a patient-oriented outcome so that you'd have something to compare back to after the treatment, either right after the treatment or maybe the next day or a couple days. But you want to have some sort of scale on the patient's level there. Then you'd want to check your contraindications and check your precautions, make sure it's safe to use this. Get the physician prescription for the delivery of the meds and have that in the file. Then you'd want to prepare your patient psychologically. So you want to explain the procedure, explain what e-stim is, explain how it works in as simple terms as you can to really get the thing across. You want to explain any sensation. So usually for iontophoresis and most of our stim, you get kind of a tingling sensation, almost like pins and needles, like when your foot falls asleep. The direct current of iontophoresis gives that a little more intensely, and you can sometimes get almost like a little bit of a warm sensation. It should not be painful, okay? It might seem a little weird and feel a little weird, but it should not be painful, and we can decrease intensities or things like that if we need be. You always want to also offer to demonstrate on yourself. So give a dry run, maybe use the vinegar, use water, so you would show what it would do. If the person's uneasy, you can give that option. Then you want to prepare the patient physically. So are they comfortable? Make sure they're in a comfortable position. Iontophoresis can take anywhere from about 10 minutes up to about 30 minutes. So are they in a place that's comfortable for them? Is the area exposed? We want to clean that area with the alcohol swabs and prepare the skin. So again, do you have to shave it? Do you need to debride it? You want to check for any open wounds. Okay, and note that, and don't put the pads directly over those areas. Then it comes time to prepare the equipment itself. So for the iontophoresis, I'll show you this when we demonstrate in class, you're going to remove the electrodes from their packet. You'll fill the syringe with the medication, and then you'll have the active pad, which has a little sponge on it, and you have the dispersive pad that has no sponge. The electrode itself should also say how much medication it can hold. So it'll say either 5 milliliters or 5 cc's or 10 cc's or whatever it might be. So you fill the syringe up with that amount of medication and you wet the sponge, okay? So even though it looks like a needle, the needle does not go anywhere near the person. You use the needle to wet the sponge. And then you put that directly over the area we want to treat, and the dispersive pad goes away. And then we're going to attach the cords. And this is when we have to know our polarity of our medication. So if we use dexamethasone for anti-inflammatory effects, okay, we're going to want to make sure that we put the negative channel or the negative cord onto the dexamethasone, onto the active, and we would do the positive on the dispersive, because like repels like. So we want to drive those negative ions into the body, so we want to drive it away from the pad. And so we want the same charge as the medication on that pad. So on our machines, we have a black cord and a red cord. Black is negative, red is positive. So if we were using dexamethasone, the black one would go on the sponge. Then we're going to turn it on. And with the iontophoresis, we actually have automatic settings. Okay, so we set the dose that we want, and then based on the amount of intensity that they can handle, we start at the lowest level of intensity of the milliamps per minute, the lowest dose, and we see, are you okay there? If they're okay there, we can try up to the next level. If they're okay there, we can try up to the next level. And because what the length of time is all going to be based on how much intensity we're putting in through that, that current. So if they're on the lowest setting, it's going to take usually about 30 minutes. If they're on the highest setting, that's closer to about 10 minutes. So it's all what they can tolerate. They're going to get the same amount of medication. It's just the amount of time that it goes through. So we can do this usually every other day, depending on the medication and what the prescription calls for. And we usually do it for potentially up to about 3 weeks. If we go any more than that, it's probably not working the way we want it to work, and we should reevaluate our goals and reevaluate the condition. Then our post-application steps. So after it beeps, we would turn off the machine. We undo the electrodes, and we throw the electrodes away. They're one-use experiences. We put the unit away, check the area for any redness or burns potentially, and make any notes. You'd also want to do that pain scale or the patient-oriented outcome again. And then you want to give the patient some instructions. So there's probably something else the patient's supposed to be doing besides just getting the Ionto. So what exercises should they be doing? What are we going to do next? Should they be resting? Is there any self or home treatment they should be doing? We'd also want to schedule their next treatment or the next time they should come in. We'd want to make sure they know their level of participation. So are they allowed to participate? Are they limited? And then we want to document everything. Document the medication, document the settings that you used, document the patient's pain skills or their patient-oriented outcomes. Any of that information should all go into their treatment note. And then maintenance, kind of in the long term, you want to make sure that the battery is always functioning. So you want to do battery checks. You want to make sure you have extra electrodes around. You want to make sure that the cords aren't frayed at all. And if you have any problems with that, you want to make sure you contact the manufacturer of what you can do to repair that, or if you need to purchase a new one.